also impressive. So he's currently a Professor Emeritus in the Department of Internal Medicine at the University of Manitoba, and he's also a member of the Department of Medical Oncology and Hematology at Cancer Care Manitoba. And during his career, he's published the 91 papers and made about 70 invited presentations. So Brent was a principal investigator on the original Canadian Tumour Repository Network, or the CEDARNet program grant, that launched the Canadian Biobank certification program, along with the standard operating procedures and the required operational practices that has been widely adopted in Canada and globally. And of course, one of the places where that has been adopted is here in New South Wales. Brent was also a member of the ISBER board, which is the International Society of Biological and Environmental Repositories, for 8 years, and he served as its president from 2016 to 2017. He was part of the writing group that created and published the ISO 20387 biobanking standard, and he also participated in the preparation of the implementation guide for ISO 20387. And of course, as I think most people on this call will know, this is now the global standard for biobanking. More recently, Brent has chaired a steering committee that created and facilitated the development of the Qualification in Biorepository Science, or the QBRS examination, that was created by ISBER and the American Society of Clinical Pathology Board. So this is an online examination that qualifies and certifies biobanking professionals around the world, and it has been used. It's been taken up in countries from Australia through to North America and Europe, and essentially all around the world. And it's the first and only examination of its kind. So Dr. Schacter was appointed also as a fellow of the Canadian Academy of Health Sciences in 2020, which is the highest honour for healthcare professionals in Canada. He has been the recipient of many other awards, including the Queen Elizabeth II Golden Jubilee Medal, the Cancer Society Award for Excellence in Medicine and Health, and the Doctors of Manitoba Distinguished Service Award. And most recently, many of you will be aware that Brent was awarded the ISBER 2022 Distinguished Leadership and Service Award that was just made at the ISBER 2022 conference. So it's really a great honour and pleasure to welcome Brent to tell us here in Australia all about the Qualification in Biorepository Science, or the QBRS exam. Thank you, Brent.
Thanks. Thank you very much, Jennifer.
Might just ask for people, if anybody's not on mute, could people just jump on mute, because we have a little bit of background noise, I think.
Okay. So, yes, so I'll tell you a little bit about the Qualification in Biorepository Science, or QBRS exam, and then there'll be an opportunity, I think, at the end for questions, of which you may have, whichever you may have. But the first thing I wanted to do was just to give you some idea about why this is an important examination, or why it is important in the spectrum of quality in biobanking. And the reason for that relates to the fact that, on the one hand, because of concerns and the importance of quality in biobanking to assure the validity of results, which are used to advance biomedicine, the ISO 20387 standards were created. The CEDARNet certification program was created. There's the College of American Pathologists certification exam was created. But these are all examinations or standards that apply to biobanks as a whole. And it became apparent to us several years ago that there was really nothing available that qualified individual biobanking professionals that really established a standard for quality and professional ability for biobankers themselves. And that was the whole point in this. So that's where I'm going to start. And first of all, I'm just going to mention the mission of ISBER is to advance the expertise and quality of biorepositories and biobanking science worldwide. And of course, the QBRS exam clearly falls within that. Vision of ISBER is to be the leading network in the global biobanking and biorepository community. And that, of course, applies to the fact that we were attempting and have, in fact, created a global examination for biobanking professionals. So what I'm going to talk about is shown on this slide as an outline. The rationale for the development. I've told you the sort of the overriding rationale. The application process and resources, the requirements for exam application, scope of the exam, some of the details about exam process, and the advantages of the QBRS credential to the biobanker. And then, as I say, I hope there'll be an opportunity for questions subsequently. So ISBER and ASCP BOC joined forces, ISBER being the leading international society promoting and focusing on quality in biobanking, and the American Society for Clinical Pathology Board of Certification provides excellence in global medical laboratory professional certification. Many or most of you will know that ASCP BOC has a number of examinations in place for various kinds of biomedical technicians. And the QBRS is now become one of those examinations. So the two organizations together created qualification exams for biobanking professionals. The qualification, as noted, is designated QBRS, Qualification in Biorepository Science. So the rationale, the immediate, I guess at the coalface rationale, is that modern biobanking is a complex activity that requires highly trained and skilled staff. Well-trained staff are essential to ensure high-quality biospecimens for all the things that go into biobanking. And prior to the QBRS exam, there was no formal qualification that existed to define the level of training required to ensure quality in technical biobanking skills. Now, it might be noted that, in fact, there are some training programs for biobankers around the world. But really, there was no formal qualification for any of those trainees or anyone that has been doing biobanking for a while. There was no way to define their level of excellence or skills once they had completed whatever training they had to do biobanking. So that was really the rationale for developing this. How do we go about it? Well, there were many discussions between ISBER and ASCP BOC. An MOU was signed in November of 2017, and an exam work group was proposed to ASCP BOC after a detailed search for ISBER volunteers to serve was conducted. We had about 35 applications and chose 8 individuals. The work group members had to be an experienced practicing biobanker or an individual with expertise in the principles and practice of biobanking. Work group members are responsible for developing, reviewing, and updating the biobanking item bank, performing job task analyses, and updating examination content guidelines, eligibility requirements, and candidate experience documentation forms that are required. And so, as I mentioned, the exam work group has 8 members that have been chosen with geographical and professional diversity in mind by ISBER. They were proposed and then accepted by the ASCP BOC Board of Governors, and the exam work group members are appointed for a 3-year term, which is renewable. And so ISBER provided the content for the exam, and ASCP BOC has many of these exams in place and has the process for these online exams well established and quite workable. And they also have the science of creating examinations well in hand. So it was a meeting of minds that brought expertise together to create the QBRS exam. The work group annually provides a report to the ASCP Board of Governors and a program report to the ISBER Board of Directors. Broad oversight of the activities of this initiative is provided by a steering committee of ISBER members with appropriate background in standards development, appointed as a subgroup of the ISBER Standards Committee. I chair that steering committee, and the ASCP is represented on this committee by the executive director of the ASCP BOC society. So the exam work group has set the parameters for the exam, developed the supporting documents for the application process, including information about the scope of the exam, and has created and standardized exam questions. The steering committee has reviewed and provided comment on the supporting materials in order to clarify and focus the content, and continues to monitor the progress of the overall initiative. So the QBRS exam development began in December of 2018 and was facilitated by face-to-face and many online meetings of the exam work group. The program was completed within a year and made available for application in January of 2020, and the exam itself became available for candidates to take about 2 years ago. The most recent results we have in terms of numbers, as of the end of March this year, 41 applicants have passed and have been awarded the QBRS certificate. While the majority of the successful applicants have been from North America, 2 are from Hong Kong, 1 from UAE, 1 from Saudi Arabia, 1 from the United Kingdom, 2 from Australia, and 1 from Nigeria. So it truly has become a global examination to establish a standard for biobanking professional activities. So what do you need to apply for the exam? Well, the resource documents, which are available on the websites, which I'll document a little bit later, include the application form, the requirements for eligibility and the eligibility assessment, the work experience documentation form, which is a form that just outlines where and how long you've worked in biobanking that has to be signed by your supervisor, a list of regional accrediting bodies for North American colleges and universities, as well as for those outside North America, which of course would apply to Australia, an examination topic outline, and a list of suggested reading for exam preparation, including journals, texts, online materials, and the Essentials of Biobanking course on the ISBER website. And I'd especially draw your attention to the Essentials of Biobanking course, because several of the individuals who have successfully challenged the QBRS exam have said that the Essentials of Biobanking course was their best preparation for the examination. So I'd mention that as a tip, if you will, if in preparation for the exam. There's a frequently asked questions element on both the ISBER and the ASCP BOC websites. And the other tip, if you will, that I provide for you, and I don't know if you can see this, but on the ASCP BOC website, there's a document called Procedures for Examination and Qualification, which really outlines everything that I'm talking to you about today in much greater detail. It actually provides all the information you need to apply for the examination, and tells you a little bit more about the process and everything else that you need to know. The the application form and resource documents are available on both the ISBER and the ASCP BOC websites, isber.org/qualification or ascp.org/BOC/QBRS. And this will come up later, so you don't have to worry if you haven't written it all down the first time around. So what are the requirements for examination application? What kind of experience do you need? And what kind of academic qualifications do you need to be able to apply to write the exam? Well, at present, there are 6 possible eligibility routes that have been established as follows. And of course, these are all detailed in the materials that I've mentioned. So don't worry too much if this becomes a little bit of a forest, which you're trying to work your way through. Anyway, route 1 is for individuals that already have an ASCP technologist or scientist or specialist certification. If you have that and a baccalaureate degree from a university with a major in biology, chemistry, biotechnology, or a related field, and 1 year of full-time acceptable experience in a biorepository within the last 5 years, then you have then you are eligible to apply to write the exam. Route 2 is exactly the same, except that these are individuals that don't have an ASCP technologist qualification, but they do have a baccalaureate degree, as I've described, and 2 years full-time acceptable experience in a biorepository within the last 5 years. Route 3 is someone with a master's degree or a PhD, again from an accredited college or university with a major in biosciences, and 1 year of full-time acceptable experience in a biorepository within the last 5 years. It would be qualified to write the exam. Route 4 is a little bit different. It's a valid ASCP technician certification along with an associate degree or 2-year diploma from a US or non-US regionally accredited college or university, or 60 semester hours of academic credit, including a combination of 12 semester hours in biology and chemistry, and 2 years of full-time acceptable experience. Route 5 is the same, except that these are for individuals that do not have an ASCP technician certification, but do have an associate degree or 2-year diploma, or 60 semester hours as in Route 4, and 3 years of full-time acceptable experience. Now, we also anticipated, and in fact, there are some people that have been in biobanking for a long time and may have gotten into it without a baccalaureate degree or a master's degree. Well, in that case, at least right now, this route likely will be grandfathered for a period of time. If you have high school graduation or equivalent and 5 years of full-time acceptable experience in a biorepository within the last 10 years, then you can qualify to write the exam. So this is the matrix of QBRS routes. And as I said, it simply is a combination of a degree or ASCP along with or not ASCP technologist certification plus experience in a variety of combinations. It provides one of 6 different routes to qualify you to apply to write the exam. Now, what is biorepository experience in terms of the QBRS? Well, experience is required in at least 4 of the 9 areas that are listed here, and they include subject consent, and then specimen and data collection, or de-identification, or data processing, and then sample and data storage, or distribution, or quality control. There are also categories including equipment quality control, that is maintenance, validation, and calibration, and enhanced technical areas. histology, tissue microarray, slide imaging, microdissection, viable cell isolation, nucleic acid and protein extraction, all qualify. So as long as you have experience in 4 of those 9 areas, and most biobanking professionals would work in a number of these areas, then that's satisfactory. What is the scope of the exam? Well, the exam questions encompass the major content areas within biorepository science, and they're split into 4 pieces. Under specimen handling, that is collection, processing, and storage, sample and data inventory management and quality control, safety and infection control, and biorepository operations. The scope document in the website provides further detail of possible topics within each of these areas, and I can actually, if anyone wants to know more about this, at the end of the talk, I can go through it. It's actually quite comprehensive, has about 30 different categories of areas that might be examined upon, and we can talk more about that if you want. Each of these topic areas will comprise 25 to 30% of the exam questions, except for biorepository operations, which will be slightly less. On the exam, there are 50 questions, and the questions may be theoretical or procedural. What happens? How do you write the exam? Well, the exam is a 50-question, multiple choice time test for 90 minutes, which is self-administered on your own computer on the date and time of your choice within the 60-day examination period indicated on your admission notification following a successful application. The cost for the application is $240 US, and the examination may be reattempted up to 5 times if initially unsuccessful, which I think is quite generous. I don't think anyone would require 5 times to do this exam if they have the requisite qualifications and experience. QBRS certificate holders will be required to revalidate their qualification every 3 years by documentation of required continuing education or other educational activities as defined by ASCP BOC. And this is fully set out in that procedure for examination and qualification document that I referred to, and we can certainly talk more about it afterwards if you wish. I can give you some. People always seem to be very nervous about this, but I can tell you that the requirement is not onerous. So we've had some feedback from individuals who have successfully passed the QBRS exam, and these are just a few quotes. I believe that this qualification will enhance my career and the visibility of my employer. And then second individual, it was great to have an exam for individuals to gain recognition for their skills and competencies as biobankers. The ability to study at home and do the exam online really helped with fitting in around daily work commitments. Then the third comment I put in here is from that particular individual supervisor. It is important for our biobank to support professional training. Hopefully, she is the first of many of our staff who will go on to take the qualification. And there are a couple of video testimonials on both the ASCP BOC and ISBER websites, and one of them I know is in great detail and very enthusiastic about the exam and the benefits to them as biobankers. There also were a couple of talks at the ISBER meeting last week, which I guess will eventually be available online or at the virtual meeting in June. ISBER will have a virtual format of the meeting. One of the talks was from this individual who's a supervisor who will talk about the advantages to a biobank of having their professionals take QBRS exam. And so that's one talk. And then there was and I think that will be quite interesting to many of you if you have the ability to access that. So what are the advantages of the QBRS credential? That's what we're really getting to. Well, we think that the partnership between ISBER and ASCP has facilitated the development of the Global QBRS Credential Program, which will be an essential piece of establishing the future for sustainable quality biobanking. We all know how important quality is in the process of biobanking, and the QBRS exam is one piece of that puzzle. The QBRS designation earned by biobankers will establish their ability to provide skilled work as a benchmarked quality biorepository scientist. So it will be valuable to them in order to prove their worth in their present job. And if at some point they decide to go to another job, then they have that as an indication of their quality. We believe that the QBRS will become the standard which defines the required level of quality in biobankers and assures sustained quality in biobanking, and that the QBRS designation will be an objective indicator of the value add of a biobanker with the qualification for the biobank itself. So, and again, there is a document with frequently asked questions, which again is available at both the websites. And again, if you wish, we can go through that in more detail. I'm trying not to burden the talk itself with a lot of, with just as much detail as you actually need to understand what the exam is all about. But we can certainly go into many of these aspects in more detail if you wish. And so I think we're ready for questions. I've even put in my own email if at some point you want to ask me directly, and some people have done that when they're trying to find out a little bit more about the details of the process, qualifying and taking the examination. And I think that's the end of the talk. So ready to take.
Thank you, Brent. Yeah, that was very interesting. I must say I was recently at the ISBER conference in Atlanta, so I actually heard the presentation that you referred to that will be part of the virtual seminars in June. So I'm not going to preempt any content on that. But I think we can see, so Dan Catchpool's asking a question, and yeah, I sort of had a similar question, Dan. So that's like, are we seeing employers requesting people to have the QBRS exam before they're being employed in biobanks? I had a similar kind of question, which I might use as a follow-up.
It's interesting. I haven't heard that yet, but I will tell you that one of the individuals who successfully, was successful in obtaining the QBRS said that when he told his boss in his biobank that he had done the QBRS successfully, the boss was absolutely thrilled because he felt that it established a new quality perspective for their biobank. And I think that's really, that probably is really what the talk that Allison gave at ISBER was about as well. This is an advantage not only for the individual themselves in terms of establishing the fact that they are a biobanker that does a quality job, but it also establishes that the biobank is invested in quality and quality in the individuals that it employs. So I think in time, as the QBRS exam becomes more widely established, I don't know whether it will become a requirement, but for example, if there are two people applying for a job and one has the QBRS and one doesn't, it may make a big difference in terms of who is employed.
Thank you. Yeah, look, I think that's very helpful. So Dan has got a follow-up question just asking how the QBRS compares to other sort of postgraduate degrees in biobanking, such as Masters in Biobanking courses, I think in Graz in Austria, or in Nice in France. Is it kind of equivalent, or is it a stepping stone towards that kind of qualification?
You know, it's very interesting because we actually have we've had some detailed discussions with people that are running one of the master's programs in Europe, and they wish to establish the QBRS as the examination for their students at the end of the training program. In other words, you do the master, you get a master's degree, but you qualify your ability by actually taking and passing the QBRS exam at the end of the course. And we're actually going to be introducing this as an idea for other training programs, such as the one in Lund, for example, and the one at IBBL. Because we think it can actually serve as an index of successful training in a master's or a technical program of some sort for biobanking.
Look, I've got a couple of questions, so I might ask them, and certainly if people would like to ask questions, please put them in the chat, or just raise your hand. So there's a little hand sign in Teams that you can click on, and then I'll call you. Brent, yeah, I guess my question was sort of progressing from Dan's questions about career progression. I'm wondering whether there's any intent from ISBER to, for example, do a study on the people that have passed the QBRS, like a survey, just to see whether those people have experienced advantages in their careers, such as, you know, have they gotten a salary increase? Have they increased, you know, their, I don't know, like, has it had a tangible benefit? Because obviously that would be a great marketing tool as well.
Yeah, it certainly is an objective that I'm very interested in pursuing. Once we have, you know, a fair number of people that have taken the exam, to actually quiz them on some aspects of the training, how, first of all, the actual process, and secondly, how it has affected their careers. Has it improved their careers, and if so, how? And that is certainly something that we'd like to follow up on with time. I think it's important in terms of really determining if this is in fact a benchmark that's very useful in terms of the careers of people who take the exam.
We have another question, actually, which was one that I was going to ask you. So I'm very pleased to see this from Krishnan. Is the content continuously developed, and does the scope of the exam change over the years? And, you know, does it, for example, have the capacity to incorporate new technologies such as automation and AI?
I think that what I would say is yes, the examination, it's close now. You know, it took a while to get sufficient people through the exam so that you could begin to employ statistical approaches to the answers to the exams, and to determine which might be too difficult, which might be too easy, which might have flaws in them. They do have a bank of questions, and they will certainly be changed out over time. And obviously, we will be looking at new developments in biobanking and introducing questions around those topics as time goes on as well.
And I think a follow-up question is there any access to like model questions or previous year questions?
And the answer to that is no.
Yes.
BOC holds things very close to their vest. And, you know, for example, I mean, I chair the steering committee, and I'm not on the exam work group, but I can tell you that the process is quite confidential.
That's fair enough. Look, I had a question. My other question was about, I guess, access, because, like, just from a recent experience, I'm chairing a symposium in another field, and we wanted to include people from low to middle income countries, and the conference registration wasn't certainly an issue for those people. I'm wondering whether, you know, looking at the numbers of people that have taken the exam, there are relatively few people from countries, you know, outside sort of the US or Australia or places where $240 is something that you can find. Is there a rate for people from low to middle income countries?
Well, as a matter of fact, I'm glad you asked that question, because we are right now in the process of developing a bursary program for LMIC
Fantastic.
or applicants from LMIC countries, which will help to cover the cost of the exam for individuals who apply and are successful in obtaining the bursary. Yeah, so we have thought about that, and we certainly think it's important.
Oh, that's really great news. I have a question from Alex at the Biobank. Is there any study to compare, again, people with this qualification to others in terms of quality of service that they provide?
There, as far as I know, there isn't. I mean, I think we just feel that what the exam really does is test the level of expertise and excellence of an individual who is a biobanker. And it really establishes, over time, it will establish a benchmark for quality. In other words, people that pass the QBRS exam can be assumed to have a certain level of expertise in biobanking. But we don't, there's really nothing else out there right now to compare it with, except I wasn't quite correct in saying that there's nothing else like it in the world. In fact, it turns out that the Japanese are developing or have developed a similar type of examination, but it's in Japanese. It's really going to be only useful for individuals in Japan. It's not going to have the global impact that QBRS does.
That's a good point. So I guess this exam is in English.
Yes, it is.
Yeah. Has it been, for example, translated into French in Canada, or is there anything like that in the works?
We've talked a little bit to ASCP BOC about that, and some of their exams, I think, have been translated into Spanish, but that's actually more for consumption in the United States. I can tell you from my own experience, quite a long time ago, I actually was involved in the fellowship training programs in Canada. That is, these are the clinical fellowship in my instance, medical oncology. And the exam had to be proffered in both English and French. And I can tell you that that the translation of the examination from one language into another is no easy task in terms of retaining the sense of the question, and for that matter, trying to understand the sense of the answer. It's not an easy task to do, but it is something that we certainly have in mind and will certainly keep our eyes on in the future, because it certainly would be reasonable to think about translation into French, Spanish, and perhaps even Mandarin.
Yes, I can imagine it's not just a case of putting things into Google Translate and hoping for the best, you know?
No. The whole process of translation of documents and so on is quite complex. You first translate from English into French, and then you have someone back translate it from French into English and see if it's the same. And if it isn't, then you're back to square one.
Then you're in trouble, yeah.
Yeah.
So we have a question from Anusha, who's asking about examples of the types of continuing education that are considered appropriate for revalidating the QBRS, and whether these differ based on regional locations.
Yeah, I can talk a little bit about that. I have some examples here. Let's see. And actually, this is in that document that I referred to, the procedure for examination qualification. This is detailed on page 14 and 15 of that document. the suggested continuing education activities. They're manifold. Now you need what is called 6 contact hours. 1 CMP credit equals 1 contact hour, and you need 6 CMP credits over 3 years, which really I don't think is excessive. And it can be employer offered courses, e.g. in-service instrument training, vendor sponsored, etc. And 1 contact hour is 1 CMP credit, and you need, a certificate of signed attendance. College or university coursework would qualify. Research and preparation for presentations or workshops can yield as many as 5 contact hours. Authoring a book can also provide contact hours. Editing a book, presenting a poster or exhibits, 3 contact hours. There would be an abstract identifying the poster session, meeting program or brochure identifying presentation. That gives you 3 contact hours, half of what you need in 3 years. Serving on an active examination committee or qualification work group, 3 contact hours. Serving on committees, boards related to a relevant field, 2 contact hours per year. And then subject areas for continuing education are also detailed, and they can be good clinical practice, including research, subject protection, specimen and data collection, handling, processing and storage, inventory management, enhanced technical areas, biorepository operations, quality assurance, quality control, and safety. In other words, anything that goes into biobanking, it can be a subject for continuing education. So, and as I say, that's all detailed in that document that's available on the website. And as I say, I don't think it's a very onerous requirement for requalification.
I guess what about the, we have Biobank certification here in New South Wales that was based on the CEDARNet bio certification program, and that is really based around education. Is there any kind of overlap between the education modules within the CEDARNet program that would be available to people here in Australia, or, is that something that can be also used in that way?
Well, as I mentioned, Jennifer, during the talk, we've had feedback from several individuals who have successfully completed the QBRS examination that one of the things that they did during the course of their preparation was to take the CEDARNet Essentials of Biobanking course, which is available, I think, both on the CEDARNet website and also on the ISBER website. And they felt that that actually was the best preparation that they had for the examination, which sort of makes sense because the CEDARNet certification is based on ISBER best practices and some of the ISO elements as well. So yeah, I mean, I think that anyone that's participated in CEDARNet certification and is familiar with the education program that CEDARNet provides, which is really the Essentials of Biobanking course, would profit from that in terms of being prepared to write the exam successfully.
Right, now thanks for clarifying that. That's very helpful. We've got a question about the utility of the QBRS exam in terms of preparing for ISO 20387 accreditation.
Well, I think that it's just slightly different. Obviously, ISO 20387 accreditation is a very detailed process, and within it, there are certainly elements around training that are requirements. But what we're talking about here is actually proving that you've had the requisite training and experience to be a quality biobanker. So it's actually part of the requirements for ISO 20387, I think is probably the best way to put it. But certainly they are intertwined. Many of the elements and the essentials of biobanking course go right into what is required for quality biobanking as proffered by ISO 20387 standards.
Thank you, and I think Jane's reminding everyone that there will be a session around the quality tool chest available to biobankers at the upcoming virtual meeting, and the QBRS examination will be one of the tools that's going to be presented and discussed.
Right. I wonder, can I stop sharing so I can see some people?
You definitely can. Sorry, we should have got you to do that earlier. I know it's a bit of an isolating experience, isn't it? It's presenting.
It really is. Yes.
And it's about nearly 10 o'clock at night where you are.
Yeah, well, that's no problem. I'm not, I don't usually go to bed much before midnight here, so that's fine.
Well, you've been very kind to, I think, accommodate our time. It's a rare treat for Australians to be, speaking with somebody such as yourself during business hours. Usually it's us at 10 o'clock at night or something like that. So we really appreciate you joining our seminars when it was organised at 12 noon here. I think we've had some really great discussion, and I certainly feel as if I know a lot more about the QBRS exam, and I think within the statewide biobank, we'll definitely be looking at that as an opportunity for all of our staff.
Yeah.
So, and it's just fantastic also to hear about initiatives to make it accessible to people all around the world as well.
Yeah, Jennifer and I, as I say, if anyone has any questions subsequent to this, something they didn't quite think of during the course of the talk, as I say, I've got I think you have my email anyway. People can email me directly, or they can get hold of Anna Torres, the ED at. She usually refers questions on to me in any event. So, because I'm quite open to trying to answer questions as long as it's not the answers to the questions on the exam.
Yes, and that's quite reasonable. Yeah, so this talk we've recorded the talk, and so it will also be available on our website probably in just a couple of days. So, and that's something that people can also refer to, and I know your email address will have been captured in that as well.
Great, thank you.
So I think we might let you go, given that it's getting late in Canada, but thank you again so much for coming to the Statewide Biobank and presenting the QBRS exam to biobankers in Australia, and thanks to people from all around the world who have joined in. It's wonderful to have you here.
Well, it was my pleasure. Thank you very much, Jennifer, for the invitation in the first place.
Thank you. Thank you. Take care, everybody. Thank you. Thanks for joining us.
Well,
Bye-bye.
see you, Brent.
Bye now.